This is a lecture for Chapter 2, and Chapter 2 covers the organization of care. This is a very big chapter, kind of stuffed full of a lot of terms around healthcare. And it's an important one because it does lay the foundation for our discussions as we move forward. So on page 15 and 16 of your text, there are dozens actually of terms that you really should make sure that you understand. Some of them you will have already heard of, others you will not have, and there is a glossary in the back of your text. So take the time to read the definitions for those that you don't understand. So we start with the fact that in the opening paragraph of this text, it says, in the United States, healthcare is delivered through a complex and multifaceted system of private and public institutions that operate in cooperation with, but largely independent of, each other. And this is unlike other countries. There's no central government agency to control the delivery of healthcare, even though the government is the major purchaser. So we have an extremely complex system. It has its strength, but it has many, many weaknesses. And quite a few of those weaknesses have to do with the fact that there are so many entities that are poorly coordinated. There are issues facing providers of healthcare. This is not an easy place to work at all times. A lot of pressure and scrutiny from the government, from insurance companies, from the public. Healthcare providers are expected to control costs, increase access, and also to provide quality care. Because of all of these stresses and this complex system, they need to adapt continuously to survive. And we'll talk about adaptation in our discussion today. Before we talk about healthcare and healthcare systems, it's important to identify health, and this is the World Health Organization definition for health. So it encompasses quite a lot. All of the organizations, institutions, resources that have a primary purpose of promoting, restoring, or maintaining health. So that is why this chapter is so large. If we're talking about health care, we have to address all of that. It's also extremely important, and we will talk about this as we move through the course, to acknowledge that health is affected by a myriad of factors. So not only the policy set by our governments, but also individual behavior, and we will have a unit dedicated to that. Also, social determinants, things like where you live, how much money you have, the environmental pollution in the areas that you live and work, and the list goes on and on. Physical determinants, biology and genetics, and access and availability of health services. So we will later discuss this in more detail, but this is very important to understand that health is not just the result of one thing, one factor. Now, prevention is extremely important as part of health care, and it was the major focus of the ACA. The ACA, Affordable Care Act, Obamacare, is in a bit of disarray because of the present administration's assault on that piece of legislation. So the future of the ACA is a bit uncertain at the present time. When discussing prevention, we have different types, and you can see they are listed here. I'm not going to read all the terms. It is important in a chapter so packed with terminology, not just to skim over, but to make sure that you do understand each of these terms and their implications. When we talk about prevention, we have to discuss public health, community health, and population health. This is an ideal time to discuss these different factors because we are moving through a period of a pandemic, and public health, community health, and population health has been in the forefront of the news, but also the focus for much of the efforts of government and healthcare. When talking about prevention, there are different levels of prevention. If you go into nursing, they need to understand these different levels. Primary is reducing the occurrence of a disease, secondary, detecting it early, and tertiary, managing that disease to prevent damage. Acute care is probably something you've heard of. That's short-term intense medical care. Also has different terms to describe it and the type of acute care. They're listed here. Also outpatient or inpatient, emergency services. You can see how complex this gets. I'll let you look at this figure. It's in your textbook. These are the domains in acute care. Emergency care as part of acute care is interesting to look at for just a minute. Your textbook has some great statistics about emergency care and how that is being used. Okay, so as far as emergency care, there are different levels of emergency care. We also have legislation in this country that defines the necessity, the requirement that all patients who present themselves to an emergency department must be screened and evaluated. So you can't turn people away without evaluating them. This sets up this is a great piece of legislation, certainly, but it sets up a little bit of a problem in an era when many don't have access to a primary care provider. And the interesting statistic that is found on page 21 of your textbook is that in 2015, when they looked at emergency department visits, 61.2% were either semi-urgent, non-urgent, or not triaged. So what this means is that the emergency room has become a primary care provider for many, and this does suck up some of the resources that would usually be used for those who require actual emergency care. Urgent care is ambulatory, but not needing emergency department care. There are a lot of urgent care settings, and I'll let you read through this to a list of hospitals, types of rehabilitation, etc. Again, read your text carefully. We have a number of hospitals in Philadelphia. We do not have a public hospital any longer. There are a number of hospitals that may be considered to be community hospital-like. Some consider Temple University a community type hospital. Okay. And onward to physician organizations. Again, you can see how dense this chapter is. So this is an interesting area because not only does it describe the different structures of physician organizations, where physicians work, how they are structured within those practices, but it comes up later as a part of the area where adaptation will be occurring in the future. Long-term care organizations. Your podcast for this chapter covered the fact that there are empty beds and closing long-term care organizations and the need for adaptation here as well. In the news these days, one of the issues around long-term care organizations is the large number of deaths that have occurred because of COVID-19 in nursing homes. Rehabilitation organizations and other healthcare delivery organizations as well. So when people say they want to work in healthcare, you can clearly see that that is a blanket statement and needs a little bit more detail because there are so many different organizations within our healthcare system. This leads to a quick discussion on health system performance, but we will dig into this more at a deeper level further into the course. The triple aim is meant to improve the patient experience of care and the health of populations and to reduce costs. So you can see there are 5 components of this triple aim. They're listed here. And the triple aim is often cited in readings and writings around healthcare and healthcare improvement. Patient-centeredness is another area where we as healthcare professionals should have a mission to make patients at the center of healthcare. In Chapter 1, we discussed that this is not always the case. And certainly now is a good time to talk about population health. Much of the work around COVID-19 and the management of the cases has been in looking at statistics around population health. But of course, COVID-19 is only one example of that. Now, one of the places that this chapter ends is by looking at the future of the delivery system. And in fact, the podcast talks about the future as well, the need for adaptation. And I think that's one of the greatest areas of this course, is reading about how things are changing to adapt to encompass the triple aim, to move toward patient-centeredness. And please read over this part of the text very carefully, because you will be part of these innovative models. You may even be the manager who oversees the change to these innovative models. There are some examples given, and those are always great to read about. We'll be discussing these as well in the discussion after this lecture and after you read the textbook.